If you'll just hop up on the scale for me, we'll see how much you weigh. Okay, great. Let's see how tall you are. I want you to look straight ahead, scoot all the way back to the wall. 5'6". Okay, let's come right here in room 5 and get you to hop up on the table for me. Check your blood pressure. You doing all right? And 26/82. That's good. Check your pulse real quick. Perfect. Check your temperature. Good. This way. Okay. Now that I've checked your vitals, I'm going to look at your hair real quick. If you can just do your head down. Oh, that's good. Your skin, your face, good. Any tenderness here? No? Good. I'm going to palpate your frontal sinuses and your maxillary. Any tenderness? No? Good. Look up here. Good deal. Now I'm going to palpate your temporomandibular joint. If you'd open your mouth for me. Perfect. Then I'm going to assess patency of your nares. Good. Let me get a light. I can see your turbinates and your nasal mucosa is moist and pink. Looks good. Lips. I see your tongue, eye, gums, the roof of your mouth. Lift your tongue up for me. The floor of your mouth, teeth, all looks good. Perfect. Now I'm going to look at your eyebrows. Eyebrows look good. Your eyelids. Can I open up your eyes? Look up the ceiling. All right, look down at the floor. Sclera, cornea, irises, all look great. Change this. I'm going to check the alignment of your eye with the cover test. Just look straight. Good. We're going to do this one. Perfect. We've got some light coming in. Perfect. So now I'm going to look in your eye with this. I'm going to check your fundus, your macula, red reflex, your disc, blood vessels, all of that. So look straight ahead for me. Perfect. I'm going to check this one. Good. Perfect. So now I'm going to take a look at your ears really quick. I'll take these articles, everything looks good here. Any tenderness? No? Good. I'll look in this ear quick. I can see your malleus, the incus, and the stapes. That tympanic membrane is nice and pearly gray. Check this one. Great, pearly gray. I can see those landmarks back there looking good. Perfect. Okay. Now we've done our ears. I'm going to check you for lateralization, which I'm going to place this on the top of your head. I want you to tell me if you hear it more on one side than the other, okay? Is it equal in both ears?
Mm-hmm.
Perfect. So now we're going to do air and bone conduction. So I'm going to hit this again. I'm going to place it on your mastoid process. When you stop hearing it, let me know, because then we're going to pull it to the front, okay?
Mm-hmm.
Okay. great. That's twice as long as you can feel it, so that's good. Next, we're going to move on to your cranial nerves. So I've got something here. I want you to close your eyes, and I want you to tell me what it smells like for me. This is going to test cranial nerve 1.
Vanilla.
Good deal. Vanilla. For cranial nerve 2, we're going to step outside. We're going to check your eyes, okay, for vision. Okay. Right out here. And if you would, please stand right here for me. I'm going to get you to cover up one eye. Perfect. Can you read this line for me?
DEFPOTEC.
Perfect. Can you swap eyes for me? Now, can you read it backwards this time, this way?
CEFDOTED.
Let's go up a line. Can you read this line for me?
PELOPEZD.
Let's go one more. Read this one for me.
EDFCZP.
Perfect. We've got 20/30 with the right eye and 20/20 on the left. We can go right back here into 5. Okay. I've got one more test for you for cranial nerve 2. This is to check your periphery. So if you'll cover up your right eye. Perfect. I want you to tell me when you see my hands.
Mm-hmm. See it. Mm-hmm.
Keep looking at me. Tell me when.
Now. Now.
Perfect. Let's change eyes. Let's do this time.
Now. 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 Now.
Perfect. One more time.
Now. Now. Now.
Perfect. So that was cranial nerve 2. And the last thing for cranial nerve 2, but it's also cranial nerve 3, is direct and consensual light. So I'm going to place my hand here, and I'm going to check both pupils to see if they're both reacting to this light. 4. Perfect. Now I'm going to get you to look at my pen light. Now look at the wall. Now look at the pen light and back at the wall. Perfect. That was for accommodation. Moving on to cranial nerves 3, 4, and 6. It's the H test. So I want you to follow my finger. Perfect. Perfect. All right. That was 3, 4, and 6. So then for cranial nerves 5, there's 3 tests for it. So I'm going to get you to clench your teeth together for me. I'm going to palpate that muscle right there. It's great. And then also we're going to do light touch. So I want you to tell me when you feel it.
Mm-hmm.
Perfect.
Mm-hmm. Mm-hmm.
Okay. And then we're going to also do sharp touch. Okay. So when you feel this, tell me.
Mm-hmm. Mm-hmm. Mm-hmm.
Perfect.
Mm-hmm. Mm-hmm.
Good. And that was cranial nerve 5. Cranial nerve 7, there's a few things I'm going to get you to do. I want you to raise your eyebrows. Can you squint your eyes really tight? I want you to smile, frown. Can you show me all of your teeth, top and bottom? Perfect. And let's puff out those cheeks. Good deal. Now we're going to move on to cranial nerve 8. I'm going to whisper something in your ear. I want you to tell me if you can hear what I said, okay?
Cat.
Perfect. I'm going to whisper something here.
Elephant.
Perfect. You did it. So now for cranial nerves 9 and 10, I'm going to look in your mouth. I'm going to check your uvula and your gag reflex. So let me get a thing. Okay. Open it real big. Good job. Okay. And then I'm going to get you to move your tongue side to side. Perfect. And that was cranial nerve 12, going side to side. For cranial nerve 11, I'm going to get you to push your shoulders up for me. Good job. That's your trapezius and your sternocleidomastoid muscle. Okay. And then just from talking to you earlier and just now, that tested your voice and your articulation, which is cranial nerves 5, 7, 10, and 12. Okay, so now I'm going to look at your neck. Looks great. Good. Any tenderness here? No. Good deal. I'm going to check your range of motion. So if you'll flex your neck, extend it, rotation, and then lateral bending, side to side. Perfect. Now I'm going to check your lymph nodes. You have your occipital back here, your postauricular, preauricular, parotid, retropharyngeal, submandibular, submental, your anterior cervical chain, and you have 2 posterior cervical chains, and then your supraclavicular, and that's great. Okay, so then I'm going to assess your carotid artery, one at a time. We got good here. Perfect. Let me listen to that right quick. Perfect. Good deal. Okay. So I'm going to make sure that trachea is nice and midline. I'm going to assess for external jugular vein distension at all, and everything looks good. And now to check your internal vein, jugular vein, we would get you to recline at a 45-degree angle, and we would shine a light across, but we don't have a table to recline on right now. Okay, now we're going to hop down. I'm going to check out your thyroid gland. I'm going to turn this chair right here. Okay, if you'll just have a seat right here for me. I'm going to give you a glass of water if you'll just hold on to that. There we go. Alright, I'm going to get you to take a little sip. Hold it in your mouth. Can you look down and to the right? There you go. Swallow. Good. Take one more sip for me. Perfect. Down and to the left. Swallow. Good. Perfect. Alright. You can hop up. I'm actually going to not get you to get back on the table. I'm going to check your back out real quick. So, you'll just stand right here. I'm going to look at your posterior thorax. Everything's good. I'm going to observe for some respirations real quick. Okay, I'm going to palpate for any tenderness. Does any of that hurt? No? Good. I'm going to do respiratory expansion. If you could please take a deep breath in. Good. Perfect. All right. Now I'm going to get you to say 99 each time you feel my hand place on your back.
99, 99,
A little louder for me.
99, 99, 99, 99.
Perfect. All right, and then I'm going to percuss. So I'm going to use my little hammer to do this. Okay. Good deal. And now I'm going to assess, I'm going to percuss for diaphragmatic excursion. So I'm going to get you to take a deep breath in and hold it for me. Good. I'm going to put a piece of tape right here for me. Okay. Now if you'll exhale everything. Good. Just hold out. Don't breathe in. Good. Okay. I'm going to measure that, so that's good. Yep. Okay. So take those off your shirt. You can leave those on. Alright, now that I've done that, I'm going to auscultate your lungs. And I'm going to start at the bottom at the basis, and I'm going to work my way up, okay? Deep breath in. Good. One more time. Perfect. Alright, everything sounds good. I'm going to assess for CVA tenderness, so let me know if this hurts at all. You good?
Mm-hmm.
Yeah? Okay, so we're going to turn around, and now I'm going to check the front of your chest. You can go and probably hop up for me if you like. Now I'm going to look at the front of your chest. Everything looks good. No skin abnormalities. Okay, so now we're going to do the 99 thing again, just like we did earlier. So if you'll just say it for me.
99, 99, 99.
Good, perfect. I'm going to palpate for any pulsations or thrills. Good deal. Down here, I'm going to palpate your apical impulse. Good. Okay, so now I'm going to percuss the front of your chest. You want to feel me beating it a little more? Now I'm going to listen to your lungs one more time. Deep breath in. I'm going to do the sides right here. One more. Good. Now I'm going to listen to your heart, the precordium. I'm going to do the aortic, the pulmonic, second pulmonic, tricuspid, and mitral. Perfect. Now I'm going to listen with my bell. I'm going to do that one more time. We've got aortic, pulmonic, second pulmonic, tricuspid, and mitral. Perfect. I'm going to get you to lay down. I'm going to listen one more time. So let me move this out of your way. I'm going to listen while you're lying down. Perfect. So let's take another listen. I'm going to first listen with my diaphragm, aortic, pulmonic, pulmonic. Perfect. So we're going to listen to the bell one more time. Good deal. Everything sounds good. Okay, now I'm going to check your pulses. We've got our radial. It's good. We're at 2+. Let's do brachial. We already checked our carotid earlier, and I'm going to check your femoral pulse. Perfect. Okay, so now we're going to move on to the abdomen. So I'm going to pull your shirt up a little bit. I'm going to take this. Alright, so I'm going to inspect your stomach, look for any abnormalities. Everything's good. So first off, I'm going to look at your umbilicus, any contouring, pulsations, peristalsis, and then I'm going to listen, okay? So I'm just going to listen to for bowel sounds in all 4 quadrants. Perfect. Then I'm going to listen for any bruits in your renal arteries. Good. Iliac. No bruits. Good. And femoral. Perfect. All right. Now I'm going to palpate for any inguinal lymph nodes, both horizontal and vertical. Everything's good. Perfect. And now I'm going to percuss your abdomen. Where am I? There it is. Good. Now I'm going to try to locate your liver span. I'm going to percuss up to your ribs, okay? Okay, so I got change in sound here. And then we're going to have one more in just a second. Now I'm going to come down, listen for the change up here. Oh, that was quick. Okay, now let's measure that liver span in centimeters. And we've got 6 3/4. So that's good. I'm going to take this tape back off. Perfect. Okay. Now that I've percussed, I'm just going to check you for an abdominal reflex, so if you'll just kind of relax. Good. Good. All right. Now after that, I'm going to palpate real gently, okay? Tell me if you have any pain. Good. Okay, now I'm going to palpate a little deeper, okay? Any of that hurt? No? You're good? Okay. Okay, now I'm going to try to locate your organs. So I've got the liver right here on the right side. I can feel it right under that rib cage right there. Now for your spleen, back, just the tip of it. There we go. Kidneys are hard to feel. You usually don't feel them. We'll feel for them. Okay, so I'm going to get you to sit up for me. That was good. Okay. Now I'm going to check out your arms. So I'm just going to look at your skin on your arms and the muscle mass. That's good. Okay, we'll look at capillary refill. You got your nails painted. Let's see. There's some spots at the top. Good. Capillary refills. Can you squeeze both my hands? Squeeze them tight. Good. That's equal. Good. Okay. Now I want you to close your eyes for me. I want you to tell me when you feel something.
Mhm. 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 Mhm.
Good. Okay. One more time. Close your eyes when you feel it.
Mhm. Mhm. Yes. Yes. Yes.
Perfect. And we got one more. This is for vibration.
Mhm. 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 Mhm.
Perfect. All right. Now I want you to close your eyes. I'm going to put something in your hand. I want you to tell me what it is.
Paper.
Perfect. That's called stereognosis. So now you can open your eyes. To check your coordination, I want you to take your finger to your nose and I want you to do them opposite really fast. There you go. I'm going to get you to take your hands out like this. I want you to flip them as fast as you can. Perfect. That's coordination, okay? Now I'm going to do your reflexes, your deep tendon reflexes. I'm going to start with your bicep. So if you'll just relax your arm. Good. I'll get you to do your arm back this way. Good. All right. Let's do this one. We're going to do this brachial. Relax your arm. Good. Out to the side. Good. We're going to check your forearm. You'll just rest your arm on mine. Relax your arm. Bend your elbow for me. There you go. Good. Relax your arm. Perfect. We're going to do your patellar. Good. Good. Okay. Now I'm going to get you to actually put your knees on this table just like this because I'm going to check your Achilles. Okay. So if you'll just sit up on your knees right there. Perfect. I'm going to hit you right here on the back of your foot. Good. Good. All right. Okay. Now I'm going to get you to sit right back up here one more time for me. This is called the Babinski. So I'm going to grab the bottom of your foot. Good. One more. Good job. Okay. So now that we've done that, we're going to move on to your shoulders. So I'm going to look at your shoulders. I'm going to palpate those. Everything looks good. We're going to do range of motion really quick. So I want you to lift your shoulders out to the side. That's abduction and adduction. Bring them back. Great. Flexion. Come up. Forward flexion. Come up as high as you can. Do your arms up. Come on up. There we go. And then can you do hyperextension? Can they go behind you? I know you're sitting down. Do you need to stand up? No? Okay, good. And now I want you to do internal rotation where you take your arms and go across your chest. Good. And let's do external rotation. Reach up like you're scratching your back. Perfect. Can you do the other arm? Good. Okay. Now let's do elbows. Elbows look good. Now can you flex your elbows for me? Can you extend them? Perfect. Supination and pronation. Perfect. Let's do hands and wrists. Everything looks good. For the wrist, I want you to flex your wrist. Can you extend your wrist? Perfect. Can you abduct your fingers, flex your fingers, extend your fingers? Radial and ulnar deviation is where you turn, not your arms. Hold your arms still and just do your hands. Good, perfect. And let me feel for any epitrochlear nodes in your arms. Good. So now let's move on to legs. So if you'll just lay down for me real quick, I'm just going to look at them real quick. I'm going to look for muscle mass, the skin, hair distribution, venous pattern, all that's good. Okay, now for this one, most of the legs we're gonna get you to stand up for do it, okay? Okay, so I want you to abduct one leg, out, bring it back in, perfect. Out with the other one, bring it back in, perfect. Can you go forward, flexion, hyperextension? Scoot up a little bit for me. Stand back, there you go. Go forward with the other one. There we go. This is testing your balance, isn't it? Good. Okay, now we're also going to do internal and external rotation for these as well. So if you'll cross in front of you, perfect, and then cross behind you. All right, do the other one, cross it, and cross it behind you. Good. We're going to learn in dance. You can hop up for me. Well, let's do knees real quick first. Sorry, let me check out your knees. Everything's good. Can you flex your knees for me? Bend it up, straighten it back out, bend the other one, straighten it back out. Perfect. Now we can hop up because we're going to do feet, okay? So let's check out your ankles and your feet. Everything's good. Okay, we're going to do dorsiflexion and plantar flexion. So I'm going to get you to pull your toes up and put them down. Good. And then inversion and eversion of your feet. Good. So now I've already checked your femoral pulses. I'm going to check your popliteal pulse. Good. All 2+. You got good pulses. Let's do your dorsalis pedis. Good. And posterior tibial. Good. I'm going to check capillary refill toes. Good. Let's check the other one. Good. All right, we're going to check your muscle mass. So if you'll just push up against me. Perfect. Good. Okay. So now let's check your spine. So I'm going to get you to hop up one more time, up and down. All right. So I'm going to look at your spine and feel that. Everything's good. No tenderness. If you could bend over and touch your toes for me, we'll check for scoliosis. Nice and straight, good deal. And that's testing you for flexion, so now let's hyperextend. If you could bend back for me, good job. Rotation, so twist, good, other way. And lateral bending, so to the side and to the other side. Perfect. Now you can turn and face me. We're going to do a Romberg test. It's where you're going to stand here with your eyes open first, feet together, arms out. Good job. Okay, now can you close your eyes and just stand there for me just a second? Good. And I was just checking for see if you're going to have any swaying or anything, but you're good. I watched your gait when you walked in, and the last thing we're going to do is check for balance. So I want you to walk heel-toe for me. If you could do that for me, heel to toe. Good deal. And then if you could come back and walk on your tiptoes. Perfect. That's good. All right. Thank you.